Hello everyone. Now I'll discuss question of psychiatry. Well, we have a 76-year-old woman and she's brought to the emergency by her son with several days of confusion, disorientation and decreased oral intake. Well, she has already mild dementia, hypertension and type 2 diabetes mellitus in the history. Her son says that she has been talking to people who are not there and she's wandering around the house in the middle of the night. No history of recent fall. Medication include metoprolol, valsartan, and metformin for diabetes and hypertension, of course. Temperature is very mild, temperature is there. BP is 100 by 60, pulse 100, finger stiff glucose 155 milligram per cent or so-called 8 millimole per liter. Not very high. Now, in the initial evaluation, most likely to indicate to the precipitating cause of this patient condition is, well, this is the question. The answer is serum electrolyte and urine analysis. Why this answer? The patient complaint is mainly consistent with delirium. But before we discuss the question, what is delirium as such? Basic question. It's an acute confusional state. Like in this case, it's a short history of few days only. Consistent with reduced or fluctuating level of consciousness and inability to sustain attention. She's wandering in the house, not able to, and she's talking to someone. Okay. It's one of the most common disorders seen in elderly person. Our patient is an elderly lady of around 67 years. And with medical illness. That's very, very important. Delirium is usually related to some medical illness is there. Our patient has a lot of problem, diabetes, hypertension is there. And it is also there with anxiety, agitation or hallucination. Well, patient with underlying condition like Parkinson's disease, dementia, advanced age and prior stroke are more likely to develop this delirium. In our case, already patient has mild dementia. She's already like a elderly lady around 67 years. So she is more likely to have this type of problem. Okay, now what are the common precipitating factors which can cause delirium? Infections, urinary tract infection. In her case, the temperature is 99 degrees Fahrenheit, also called 37.2 degrees centigrade. She has a mild fever. Well, fever means some infective pathology is there. Then we have to rule out urine infection, very common in the elderly person. Polypharmacy, she taking a lot of drug, although none of them drug is well known to cause any problem. Like she taking valsartan, metoprolol or metformin, none of them can lead to this type of problem. But definitely in other causes, this thing should always be kept in the mind. Medication side effect. Volume depletion and electrolyte or metabolic disturbance are very well-known cause of this type of problem. So we know the causes. We know who are the people who are going to get affected. So that's why whenever we are evaluating this case, history is very important. Physical evaluation including pulse oximetry, which will tell you oxygen saturation. Review of all medication because polypharmacy is a well-known cause of delirium. Complete blood count to rule out any infection, like in this case, quite possibility UTI is there. Then we expect TLC count to be high. That will further support our diagnosis of any infective pathology. Serum electrolyte should be taken care of. Urine analysis to rule out UTI. Well, so in this case, if you go by this approach, we are likely to find the cause of delirium. Now, let's look into other options. Brain MRI. Well, this is to diagnose any case of brain abscess, encephalitis, subarachnoid or intracranial hemorrhage. Well, it is usually done in patient with delirium of unknown cause to exclude acute stroke or intracranial hemorrhage. In that case, we like to do CT scan. If you are not able to find by history or any other thing, remember subdural hematoma can also be a problem like this, which can manifest like this. So in such cases, we go for CT scan. MRI is performed when CT scan doesn't reveal anything, then we can go for MRI. But anyway, in our case, there is nothing like which is suggestive of CT or MRI's indication is there. Complete blood count and iron studies, it is done for evaluation of delirium by strong possibility. Leukocytosis will indicate infection. Iron studies are more likely to think of chronic anemias. But as far as patient has no symptom of anemia, fatigue, etc. is not there, infective pathology is can be possibilities there. In this, so TLC will simply tell you that infective pathology is there, but it will not pinpoint the exact cause of delirium in this case. So that's why urine analysis and electrolyte are preferred over TLC count. ECG and serum troponin T tests, very obviously they are the investigation to rule out acute myocardial infarction. And it's not a case like this. The patient already has problem for last many days, wandering around in the house. So this is definitely that's definitely not a case of coronary artery disease. Moreover, coronary artery disease doesn't manifest with delirium. It's not a cause of delirium. And there are no cardiac symptoms, so we can very comfortably rule out this option. Lumbar puncture we do for those cases where we think of any infective pathology like meningitis. Okay, especially meningitis. Sometimes normal pressure hydrocephalus, but again not a common investigation for MRI is the best. Demyelinating disorder like multiple sclerosis, again MRI is done first. There are very few indications where we need to do lumbar puncture in meningitis, in case of in multiple sclerosis, but yes, meningitis, but they present in a different way. They have a usually high grade fever, headache is there, neck rigid, which is not there in our case, so this possibility ruled out. Okay, we do for unexplained fever, focal deficit. Okay, as I told you, neck rigidity, so definitely it's not a first line investigation in delirium. So golden line to remember, delirium is an acute confusional state of characterized by reduced or fluctuating level of consciousness, along with inability to sustain attention. Patient has anxiety, agitation or hallucination. Common precipitating factors include infections, polypharmacy, medication side effect, volume depletion and electrolyte or metabolic disturbances. Thank you very much.